Hi, my name's Annie Govig. I'm a physical therapy student at Regis University, and in this brief video, I hope to help you get a better understanding of chronic pain. So, pain is a universal feeling or sensation, but what exactly is it? Pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. It's generally thought of as acute or chronic. When we think of acute pain, we think of pain that has been caused by tissue damage. For example, when a person sprains their ankle during a soccer game, there is most likely damage to their ankle ligaments. Pain receptors in the ankle sense this damage and send a signal to the brain. The brain then perceives this damage as harmful, and the body responds with things like swelling, redness, heat, and pain. Eventually, this pain subsides and then disappears as the tissue heals. However, when we think about chronic pain, we think of pain that remains even after the tissue has fully healed. Why does this happen? At this point, pain is no longer about tissue damage, but more about the sensitivity of our nervous system. In order to understand this phenomenon, it is helpful to take a look at some of the factors that may be contributing to chronic pain. Let's say that the soccer player who has sprained their ankle has gone through some rehab, and enough time has passed for the tissue in their ankle to fully heal. Structurally, they should be able to get back on the field and play again. However, let's say that this person was riddled with fear throughout their whole recovery process. Fear that their ankle is not strong enough, fear that they won't be able to shoot the ball as well, fear that they'll get hurt again. This emotional turmoil, like the pain receptors in our ankle, has the ability to send signals to our brain. Because this soccer player has learned to associate their ankle injury with pain and fear, fear in turn has become a trigger for their pain. In other words, fear in this case has caused the brain to perceive returning to soccer as painful. Emotion and fear are not the only things that can contribute to our brain's perception of pain. Many other factors, such as our belief system, stress levels, culture, self-efficacy, and our past experiences, can also contribute. In order to fully address your situation, it may be helpful to identify things in your life that may be triggering or provoking your persistent pain. I hope that I can help you identify these things as you continue on your journey to recovery. Remember, you're not alone, and I'm here for you along the way as we explore different strategies to tackle your persistent pain. While the road may feel long at times, it's important to be patient with yourself, reflect on where you started, and reflect on how strong you have been to get to this point. I hope this video has been helpful. Thanks for listening.